Ergonomics at work. Ergonomics is the practice of designing the job to fit the worker, instead of forcing the worker to fit the job. Some agencies also define ergonomics as the study of people at work. Musculoskeletal disorders affect the muscles, nerves, and other functions within the musculoskeletal system. There are many types of ergonomic practices in the workplace. This presentation will focus on physical ergonomics and review both office and manual ergonomics to help prevent injury. Musculoskeletal disorders of the wrist, neck, shoulders, and lower back are often, but not always, found in office occupations. There are a few items to review while sitting at a desk to ensure safe work is being practiced. To position yourself correctly, first set your chair to ensure your back is supported and knees are bent at 90 degrees. If your feet do not lay flat on the floor, use a footrest. Next, position your keyboard to allow your elbows to be at 90 degrees. Lastly, position your monitor so the middle to top of the monitor is at your eye level and 40 inches away from you. Many occupations associated with lifting, carrying, and repetitive motion can increase risk for musculoskeletal disorders. It is important to understand how to safely lift, move, and reach for overhead items, especially items of larger weight. Knowing how to safely perform all tasks at work and the exercises involved to prevent injury is vital. First, be aware how heavy the product is. If it is too heavy, tag the item and get someone to help you, or use ergonomic equipment for heavy lifting. If the item is safe for you to lift and carry, make sure the lift pathway is clear. Try not to carry heavier items long distances to prevent injury. After you have ensured your safe pathway, begin your lift by getting as close to the object as possible with a wide stance. While keeping your back straight, push your buttocks out and use your legs and hips to lower yourself to the object and grasp the object firmly with both hands. Prepare for the lift by tightening your core muscles and slowly lifting the object while following your head and shoulders. Lift by extending your legs with your back straight. Carry the object safely with minimal turning to its prospective location. Many exercises should be practiced to prevent office and manual injuries. These exercises should begin at the start of the shift, continue throughout the day, and end with getting proper rest after the workday. The executive stretch is a helpful exercise that may reduce fatigue and improve back comfort. Start by clasping the hands behind your head with your elbows in line with your ears. Press your elbows back as far as possible and squeeze your shoulder blades together. Relax and repeat 3 times. A planned and frequent wrist stretch may also be helpful in preventing office injuries. Start by holding your arms straight out in front of you. Pull your hand backwards with the other hand, then pull slightly downward. Hold for 20 seconds and relax. Repeat 3 times. Back exercises such as a standing back extension may help strengthen and increase flexibility in your back. It can also decrease the natural tendency to go forward while standing or sitting at work. Begin by standing with your back and shoulders straight. Take both of your hands and place them evenly on the back of your hips while keeping your knees straight. Gently bend back and hold for 10 seconds. Repeat 5 times. Practicing ergonomics in the workplace can decrease risk of strains, sprains, and pain. It can assist in improving productivity and decreasing occupational injury. Educate yourself, your coworkers, and others on how to be ergonomically safe throughout the workday.